Systemic sclerosis. Systemic sclerosis, known as scleroderma, it is a chronic autoimmune connective tissue disease characterized by fibrosis of skin, internal organ involvement, and vasculopathy, and immune system dysregulation. There are two types of systemic sclerosis: limited cutaneous systemic sclerosis and diffuse cutaneous systemic sclerosis. Um, Epidemiology, it is more common in females, 4 times, 4:1 female to male ratio. Pathophysiology, it is characterized by three mechanisms. First is vascular dysfunction, second is immune dysregulation, and third is fibrosis. In vascular dysfunction, endothelial cell injury and leading to activation of the lead to vascular dysfunction resulting in vasospasm and intimal proliferation and obliteration of the vascular lumen. This process contributes to development of Raynaud's phenomena. This leads to digital ulcer and pulmonary arterial hypertension. And the second one is immune system dysregulation. This leads to activation of the innate and adaptive immune system, resulting in the activation of the T and B cell and antigen presenting cells. This leads to antibodies and cytokine production. This leads to tissue damage and fibrosis of the skin. Third one is fibrosis, and fibrosis activation of the fibroblast and their differentiation into myofibroblast and excessive deposition of the extracellular matrix component including collagen in the skin, internal organ, causing tissue fibrosis and organ dysfunction. Classification of the systemic sclerosis includes limited cutaneous systemic sclerosis. This involves distal to elbows and knees plus minus face. Associated with limited cutaneous systemic sclerosis associated with anti-centromere antibodies and CREST syndrome. CREST syndrome include calcinosis, Raynaud's phenomena, esophageal dysmotility, sclerodactyly, and telangiectasia. And the second one is diffuse cutaneous systemic sclerosis. This involves proximal to elbow plus knee. This is severe form of the systemic sclerosis, including involve renal crisis and in lungs ILD and cardiac involvement. This type is associated with SCL70 antibodies. The next one is clinical features of the systemic sclerosis. In clinical feature, this involves skin, Raynaud's phenomena, GIT, lungs, renal, and musculoskeletal system. In skin, thickening, tightening, and hardening of the skin, which typically start in fingers and progress proximally. And Raynaud's phenomena, vasospasm, induced color changes include pallor, cyanosis, and erythema in response to cold and stress. In GIT involvement, dysphagia, gastroesophageal reflux, and motility disorder affecting the esophagus, stomach, and intestine. In lung involvement, ILD and pulmonary arterial hypertension are common complications which can cause shortness of breath, cough, and chest pain. Renal involvement include acute renal failure and malignant hypertension, and is a life-threatening complication of systemic sclerosis. In musculoskeletal involvement, joint pain, stiffness, and contracture due to fibrosis of the joint capsule and tendons. In investigation of the systemic sclerosis include autoantibodies like anti-centromere antibodies involve limited cutaneous systemic sclerosis, and anti-SCL70 antibodies include in diffuse cutaneous systemic sclerosis. And the second was a nail fold capillaroscopy. It involved abnormal capillary pattern including dilatation, avascular areas, and neoangiogenesis, and are suggestive of nail fold capillary sclerosis and suggestive of systemic sclerosis. In imaging, HRCT chest in ILD and echocardiography for pulmonary arterial hypertension. And last one is skin biopsy. Although not routinely performed, a skin biopsy showing dermal fibrosis and collagen deposition can provide histopathological evidence of systemic sclerosis. The last one is management. Vasodilator therapy. It includes calcium channel blocker, phosphodiesterase 5 inhibitors, and prostacyclin analog can help in manage Raynaud's phenomena and digital ulcer as well as pulmonary arterial hypertension. Immunosuppressive therapy include corticosteroid, methotrexate, mycophenolate mofetil, and cyclophosphamide can be used to reduce inflammation and slow the progression of fibrosis, particularly in case of ILD and rapidly progressive skin involvement. In GIT management, proton pump inhibitors and prokinetic agent can help manage gastrointestinal reflux and motility disorder, while dietary modification can be necessary for malabsorption or constipation. Renal involvement. Prompt treatment with ACE inhibitors is crucial in the management of scleroderma renal crisis. Physiotherapy and occupational therapy, these interventions can help maintain joint mobility, improve muscle strength, and address functional limitation. The last one is psychological support. Providing counseling and support for patients with systemic sclerosis is essential as the disease can have significant impact on mental health and quality of life.